Here at VolitionRx, they've just announced their Q3 results, but we also have some breaking news, and this, Cameron Reynolds, CEO, involves proof of concept around blood cancer.
Yes, Nick, we hinted on the earnings call just recently that we were expecting some news, and we got the results in blood cancers, a range of blood cancers, and the results were really quite spectacular. Just with a single assay, we managed to get over 91% AUC, which is the best result by far in any assay we've ever done in any cancer. And that's using a fully validated product grade assay, preclinical assay. So it's really quite remarkable. And also we ran a few other discovery grade assays, which also worked very well. So very exciting.
When we've been talking about the different cancers that you cover, we haven't spoken too much about blood cancer. Now, I don't want to talk about a league table here, but how prevalent is blood cancer?
It's very prevalent. There's about 500,000 new cases per year worldwide, which is tragic. And also it's more deadly in the United Kingdom than, for example, breast or prostate cancer. So it's all too common. And we didn't talk about it, but it came through actually from the veterinary space. We were looking at cancers most prevalent in animals, including dogs, and the blood cancers are very common in many breeds. So that's where we got the hint. We got some samples and we tried some of the assays, even on the most simple format, and they were truly spectacular.
You're all about early stage detection, and detection of blood cancer isn't always easy. In other words, the symptoms are not always easy to spot.
Yeah, we talked a lot about this with our Chief Medical Officer, Dr. Terrell, who's an MD, and he said it's very, very tough to diagnose because the typical symptoms are very non-specific, things like tiredness, which, as I'm sure you're aware, most people come to the doctor saying they're tired. And the next test is very, very difficult. It's invasive and it's quite a difficult follow-up test. So it's one they're loath to give for a while. So it would be a very useful intermediate to see who actually does need the next step, which is a tougher test. So it should be a very, very useful test if we can get through the next stages, which we're certainly going to do now, given these excellent results.
So in conclusion, what are those next stages? You have the results here. What will be happening from here on in?
So the results, I'll just go quickly through them. At a very high specificity, meaning not a lot of false positives, of 95%, which is very high, we're getting around 80% of the non-Hodgkin's lymphoma, which is the biggest one in the group. So really good results. The next stages, we're going to do some more populations and then look to launch a product. And as it's a product grade assays are ready, it could happen very quickly. It would be a 510K in the US, not a PMA, because it's used in conjunction with other things and symptoms. So it's something which could be done in a couple of years. So we're running some more trials over the next 12 months to confirm these results, and then we'd go straight into a US 510K. So, which would then have us with a product, and it's a massive market. And one of the great tragedies with blood cancers, it's often people quite young. So it's something which could be given to a very wide range in the population. So potentially market-wise, as big or bigger than the other cancers, because a doctor who is very worried that someone comes in with very non-specific symptoms could give the test just to try to rule in or rule out cancer. So it's something we could be very, very helpful with.
Well, thank you very much, Cameron Reynolds, CEO of Volition, for updating us on the blood cancer. And watch out for further news coming out for Volition, because there's a lot happening at the moment. Thanks very much.